Collection and preservation of rape evidence. Rape evidence can include a variety of evidence types. You can have a cross-transfer of biological fluids. This can be semen, vaginal secretions, saliva, etc., blood. Cross-transfer of blood. You can have cross-transfer of hairs and fibers, the victim's hairs on the perpetrator and vice versa, same thing with fibers from clothing. There can be visible physical injury that may or may not have markings on both people. For example, if you hit somebody hard enough at a bony place, you might end up with a bruise on the part of your body that you hit them with, and the shapes may match up. You can have soil evidence, for example, caked underneath your fingernails, etc. There's not really a whole lot of evidence types that are unique to a rape case, and there can be a lot of variety even between cases. The utmost respect needs to be tended to the victim during the entire process of examining for rape. So this person's already been tremendously violated. They may not want to go through this process of the very vulnerable process of delivering all of this evidence over. It can be a very, very invasive process to get this evidence. You're going to need to document all the evidence as we've discussed before in writing. You're going to need to take photographs. You're going to need to get a lot of biological samples in a pretty invasive way. The victim is free to walk out at any time for any reason, including no stated reason at all, if they're ever too uncomfortable to participate in evidence collection. You should be extremely sensitive to their feelings at all times. In the course of evidence collection, all outer garments and undergarments are taken. What you would do is you have the victim undress over an unfolded large white paper sheet. And as they undress, if any debris like hairs or fibers falls off of their garments, it'll be collected on that white paper. You'll package every individual garment separately. Remember, we do not want cross-transfer of evidence between items. And because they could be impregnated with biological fluids, you will always use a paper bag. If you put them in plastic or something else that's not breathable, remember, you can set the stage for those biological fluids to rot and be destroyed. The surface on which the rape took place should be collected if at all possible. So if it was on bedding, you should try to package up the bedding as best as you can without overly folding it or wrinkling it. Remember, you could flake off seminal stains or shed hairs and fibers in the process of packaging it up. If it was on something upholstered like a sofa or something, you could cut off a swatch of the fabric of the sofa where you think it occurred to collect anything that might have fallen on there. Sometimes it's not possible. If it's just on the ground, you could get a soil sample, but you might not be able to collect much else in that case. For the evidence collector, you should be very, very mindful of PPE. You're going to be dealing heavily with biological fluids. As you're employing universal precautions, remember all biological materials are potentially infectious to you at all times, and you should handle them accordingly. Full head-to-toe gear. You should be wearing certainly make sure that you have a head covering to prevent your hairs to be mixed in with the evidence. You should wear non-latex gloves, double glove, and change them very, very frequently. Biological materials can be cross-transferred and be significant with tiny, tiny, tiny amounts. Just tiny fragments of, or just a handful of cells could sufficiently contaminate the other evidence that it could become confusing for whoever's interpreting it later on down the line. A rape examination is done by medical personnel, and evidence from the rape victim is collected. Pubic combings with a standard reference sample from the victim, an external genital dry skin area swab to collect skin cells. They'll take a vaginal swab and a smear, so they're going to take this to look for the presence of semen, blood from the perpetrator, and if they find the perpetrator, to match any kind of dried vaginal secretions on the perpetrator. A cervical swab for similar reasons. Rectal and oral swabs as needed. PRN means as needed. Swab of other body areas that would have come in contact with the perpetrator as needed. Head hairs from the victim with a standard reference sample. A blood sample for toxicology purposes, not to see so much if, the victim was drinking or something, but to look for if there was any kind of deliberately induced intoxicating substances like rohypnol, for example. A buccal swab to collect the victim's DNA for comparison. Fingernail scrapings that could have soil samples, it could have blood from the perpetrator, their skin cells, etc. All the clothing is described earlier, and a urine specimen also for toxicological examination. If the suspect is apprehended, all their clothing should be all the clothing that was potentially on their person at the time of the rape should be collected using similar care as before. You should get pubic hair combings with standard reference sample, head hairs with standard reference samples, a penile swab if within 24 hours of the assault. If it's been more than that, it's not really worth your time always, because anything that might have dried on their skin was probably too degraded to use. And a buccal swab for their DNA. Remember, DNA can be characterized down to a billionth of a gram. You need a minute amount of DNA to be able to characterize at least some of it. So wherever you have the possibility of collecting DNA evidence, you should be taking advantage of that. And fortunately, if, say, the victim decides that they don't want to participate halfway through an examination or some percentage of the way through, if you manage to get any amount of biological materials off of them or off of their evidence, there's a decent chance that you're going to be able to collect DNA evidence off of it for matching later on. You may not be at a loss after all.